Hi, Dave Sheehan here from the Connect Show. Stand by for a great episode. I'll be talking with Charlotte Keane about the Certified Practitioner program.
Oncology Massage Global is running a blended learning module 1 course with 4 weeks of online education followed by 1 full day of hands-on practical in Bendigo.
The course begins on Thursday the 19th of February with weekly 1-hour Zoom meetings for 4 weeks at 6 p.m. This is followed by the practical day, Sunday the 22nd of March at the Lake Hotel in Bendigo. And you can claim 30 CPE points for attending this course.
Hi everybody and welcome to the Connect Show. Today I am speaking with Charlotte, one of our National Directors, and Charlotte will be talking to us more about certification. So welcome, Charlotte.
Thank you.
So where do we start? I mean, let's just briefly talk about what you're up to with the association, because we've got an AGM coming up. By the time this goes to film, the AGM's come and gone, but it's been a busy year.
It has been a busy year, yeah. I'm in my 4th year as a director, and I'm involved in the Sparked community with the CSIRO, the Department of Health, Disability and Ageing, and the Digital Health Agency, as well as HL7 Australia. So that's about Australia going into a healthcare system which is interoperable.
Wow, okay.
So it's a big piece of work, and
absolutely.
I'm only one of a lot of different people, so there's lots of different practitioners.
Yeah.
But I'm part of the clinical design group with that. So that's one thing that I've been keeping busy with.
So for those out there who are interested, who are members, who are interested in maybe joining the board one day, there's lots of interesting stuff that you can get yourself into. So, but today we're talking more specifically about certification.
That's right.
So you are a certified practitioner through the system here, yes?
Yes, so I was actually part of the pilot program originally when it was first launched, and I think a lot of people might wonder why do they need it, but at the end of the day, like, it was a really great thing for me. I've been a member for over 20 years, so I was sitting in my clinic. I had a clinic in Mont Albert at the time, and I had a person from Certex International as well as someone from the association come to my practice, and they were interested in what I was doing, what my business practices were like. And instead of feeling disconnected from the association, I felt really connected, and I was really proud to show people what I was doing, you know, because obviously there was room for improvement, and I welcomed that, but I felt more connected with the association. I felt like I wasn't on my own. A lot of times I think people work on their own, they don't have a manager or anything. So often when you work in a business where you do have a manager, they might say, well, Dave, I think you could improve in this area. But if you're a one-man band, you might not have that oversight. So I really welcome that.
And now, I mean, you've got a number of staff working under you at the clinic.
Yeah.
And are they also certified practitioners?
They are, yes. So, well, they've all gone through the process. We've got one person that we're still waiting to finish the process with, but everybody's gone through it. So.
And what was the motivation, do you think? Obviously, you thought it was a worthwhile cause, but did you get any pushback from your practitioners, or was there fear of something, you know, like the fact that they're going to get looked at and put under a microscope? Or should people be worried about that side of things? No,
not at all. So when I applied to become a certified practitioner, basically there's an easy QR code sort of on the website to express interest, and then you fill out a module on Halo. So you've got 9 months to complete it, so it's doable. One thing, I'm going to get to answer your question in a second.
That's okay, yeah.
But one thing that when you are doing the module, sometimes you think, wow, it's a lot of work. Like, it's not necessarily, but it might feel like it. But I want people to remember that anything that's worthwhile is worth taking a little bit of time to do.
Sure.
And I'll liken it to in the COVID lockdowns, I applied for business grants and things for my business. That wasn't an easy process, but I went through it and I got it, and so I just want to liken it to that, because sometimes people think, oh wow, it's too hard, I don't want to do it. But seriously, I want to underpin that it's important to take the time, because it's worth it.
So very attainable for the members.
Yes, and I think there's a lot of things like policies, like do you have a cancellation policy, do you have a privacy policy, what's your complaints procedure, things like that. And you might think, wow, I don't have one. Well, if you don't have one, there's templates that the association can provide so that you can bring yourself up to speed with that. So it's not, so getting round to your question about should I be worried and were they worried, my employees, no, you shouldn't be worried, because it's not about catching people out, it's about lifting the industry standard overall. So that's the important thing. So when I talk to my team, I said to them, look, this is a great opportunity to find areas in our work that maybe we need to brush up on. So, do it. Or maybe I've forgotten as your manager to tell you something, and we can take the learnings and increase our standards. So they also didn't have to create new policies or anything, because they could just use mine, because it was all of the same practice, but I employ my team.
And the fact that as part of the process, a lot of the resources are templates, and that if someone's new to the idea of doing certification, that they're not just thrown out there on their own. There is a number of resources to assist them on the step-by-step process of gaining certification.
Yeah, that's right. And sometimes I think, not everybody's got the strength in writing a policy. You don't have to write a policy. Obviously, I said there was templates. But, maybe there's one thing that you do have to do, which is a written piece, which is writing a professional development plan or a business plan. So a professional development plan could just be a one-pager about where you see yourself in 5 years. But sometimes we struggle, we have you might be a great myotherapist or a medial massage therapist, but you're not so good with the written word as far as like writing something like that. You might think, I don't know where to start. So definitely reach out to the association, because there's dedicated staff that will look after that and help, and maybe even pair you up with a mentor that can help, or someone else in the industry that's done it. So don't be put off by that. I think it's just really good to extend yourself a little. Okay,
cool. And as far as public perception, do you want to talk a little bit about that? What is the difference between a member of the association over a certified practitioner?
Yeah.
And maybe touch on the whole protection of title as well, because it's a really important factor.
Yeah, it is. So this morning I had to do something, drop my car in to be repaired actually, and I was coming back through just a suburban street, and I always look at those kind of interesting shops along the high street, and there's a big sign that said massage, right? And I was like, don't love that. And I think a lot of times in member meetings we'll get people that will say, can we protect the word massage therapist and all this sort of thing, and we can't. We've tried and we can't. So the one thing that we can do is become certified practitioners, because it is a trademark and it's a title, it's a protected title that no one else can use. So our vision for the future is to see the professional members of our association that really want to be taken seriously be known as certified myotherapist and certified remedial massage therapist, so that we can be identified against some of the people in our industry that may be saying they're massage therapists, but maybe they have limited training, for example. And so I would like to see in the USA, for example, they have licensed massage therapists.
Sure.
It's a fairly well-known term. I would like to see that here in Australia, people just, if they're going to a professional remedial massage or myotherapist, that they're going to say, I'm going to a certified remedial massage therapist or myotherapist.
So the word licensed in the States you're saying is kind of an equivalent?
Not completely, but it's just the idea of knowing the name. Now, part of this issue with the program is that some people will say, well, the general public don't know about certification, but we have to take small steps to run, right? And this whole program was, I think you were on the board too, when this program became was born. And I guess, how in research they say standing on the shoulders of giants, right? We cannot take any credit. I mean, there's been a few tweaks to the program because we changed it from certified specialist to practitioner because specialist wasn't really working and it wasn't the right name for the program. But it's something that we are committed to following through because we just see it, especially in my work with government and advocacy. We're not degree qualified therapists. I am, and some of us are. You've got a degree, I think, but that's not the be all and the end all, obviously. But unfortunately, when it comes to funding and government, often there's a cut-off line, and so we don't want to be kind of lumped in with the lesser type of therapist that's on the high street offering. Maybe they don't have the training.
A weekend qualification.
Yeah, or whatever, right? Or come in from overseas and they haven't got Australian qualifications, for example.
So Charlotte, as far as government, health funds and other, how do you think the certified practitioner becomes part of that conversation?
Okay, well, the certified practitioner is a national best practice standard and quality assurance credential. So sure, we can have our qualifications and we can have our insurance and we can meet all of our compliance to be a member of our association. Fine. And then a lot of people will say, well, why do we need anything else? But the thing is that some people can say that they do all this, that they take their clinical notes and they keep their towels, the clean towels, away from their dirty towels or whatever it is, or they have policies in place, but they may not. So this program gives a level of compliance and oversight, and having someone come in and have a look at the practice, and it's just a tick to say your business standards meet best practice.
Do you think there's a misconception with some members that they think it might be to do with the techniques that they're doing? It's more aligned to business practice and best practice.
And the reason being, we're not testing to see if you're a good enough practitioner at what you do with your skills.
Sure.
But it's just to make sure that the environment in which you work is safe for you and safe for your clients and patients. So that, and then we want private health funds and government, and a lot of times we have a lot of therapists that ask for more funding. Like, why are we not included in more programs? So having this, being able to say that we're certified practitioners, it gives assurance to those government bodies, for example, that we are professionals, okay? So we're not part of APRA, so we need something else. We are part of a peak body, and that's amazing, and this association, I think, does a great job. But we can't get away from the fact that we're lumped in with those high street massage places at times. So the only way that we're really going to be taken seriously is if we have a trademark and a name that can't be taken away from us. We can't say we're only allowed to use massage therapists as our name. We can have the certified practitioner as a credential and no one else can use it.
Sure,
yeah.
Sure. And the time that it would take for one of our members to from start to finish to actually get that certification, how long should it take? I mean, obviously there's...
Well, there's a criminal check that you need to do every year. I actually, so basically the initial interest, no time at all, and then you'll get set up with the Halo module, and then you need to work through that at your own time. I did say you have 9 months to complete it, but I mean, you can get it completed in a week or two if you want to put your attention into it. I've done some study and things like that, so I mean, it's just about like doing a little project, I guess, and you sit down and write down your professional development plan, or you look at your risk analysis in your clinic. So there's like templates for risks, so you can identify 3 different risks, which is an awesome thing, and then you look at how can I minimise the risk, so you can see how that's the safety part coming through as well. So how long does it take? Well, it depends obviously on the office will need to process the application. It goes to a independent standards council for review. And then the very big strength of this program is it's not the association that makes the final decision. It goes to Certex International, who are the external auditors, and they have the final decision to award a practitioner as certified. And then that gets reviewed every 3 years. So the annual police check is the only thing that will cost anything, but for massage and myotherapy members, this is free.
It's free.
It's free at the moment. So
Right.
I mean, okay, there's work involved to like do the paperwork.
Yeah.
But it's free, and also and it's open to other members of other associations. But there's a charge for everybody else. But it's free for our members. So.
The simple fact that you're having an opportunity to review your business, and anyone who takes business seriously, it's something that you should be doing anyway. You should be reviewing your business constantly to see where you might have some pitfalls in policy, for instance, or whatever. And this program guides you through that.
Yeah, it does.
As well, and it doesn't cost anything.
Definitely, yeah.
Yeah.
Yeah, I think for years people have been asking for more and more about why can't we be recognised, and I think, change starts with you, and sometimes the world is crazy, it definitely is at the moment, and so one thing that you've got control over is your own standards and practice. So I take that on board. I walk the walk and talk the talk, and that's why I'm 100% behind the program. And I believe in what we do. We've got like an amazing modality, and I've been doing this job for over 20 years, and I mean, I think we've got the best job of ever, really. We're quite holistic. There's a lot of the allied health, which we always kind of compare ourselves with, that are part of ARPA. We're obviously part of allied health loosely through our association with ARPA, but I think what we do with our hands and the holistic approach that we have, it's priceless. And we help a lot of people in chronic pain. There's a lot of people that have gone through surgical procedures, they've gone through rehab, and they're still in pain, and they come to our doors. We want those people to find the practitioners that are safe to work with, and we want the professional therapists like us that we want to encourage more of that work to come to us, because we know what amazing outcomes we can provide.
Absolutely, yeah.
And I'm saying that not being big-headed, because it can be different for every person and everything, and we don't fix people, but we can facilitate their healing, and it's a wonderful thing to do in a safe environment, and that's what Certified Practitioner brings.
Charlotte, it's been a pleasure talking to you about certification. Everyone get on board. Website, I'm assuming our website.
It's on our website, yeah.
Jump on the website,
yeah,
and there's a bunch of information up there to get you started. So please, it's worthwhile having a look. And as I said earlier, just to review your business, and that's what this is all about. It's actually looking at your business. It's a really important thing, and it comes at no cost except for your time
and the
criminal check.
Yeah. One thing about the criminal check too, it's like good to have all this compliance stuff in order, because like I work at the Australian Open, for example, or with the Support at Home program for aged care, and often you need to provide documentation. So having that like up-to-date police check and everything is wonderful.
Yeah, absolutely.
Yeah.
All right, well, once again, thanks so much for joining me on Connect, and wish you all the best. Are you doing the tennis again this year?
I am in January, yeah.
Cool. Well, enjoy that.
Thank you.
Okay. Thanks everyone for listening.